Hello friends, welcome back to my channel Dental Minibytes, Basics to Mastery about all dentistry related educational videos. So today's topic is on schools of retention. But before moving on to the topic, we just want to know about three terms. One is retention, another one is relapse and stability. These three terms are totally confusing for all. So we just want to know about the difference between three terms, and the retention process should not be carried out at the end of the orthodontic treatment. It should be often decided during the time of diagnosis and treatment planning itself. So retention, it was given by two authors. One is Jundeff and Riedel in 1985. He defined retention as the holding of teeth in a idealistic and functional position. Retention is nothing but the teeth should be hold on to that place, that is the original, the new position, with the help of retainers. And according to Moyers, he defined as maintaining the newly moved teeth in position. That is, after orthodontic treatment, the teeth is moved to a new position, right? So the maintenance of that newly moved position is retention, which is helps in aid in stabilizing their correction, so that the correction is stabilized after orthodontic treatment. So this is about retention. Then the next term is relapse. Relapse is nothing but loss of any correction achieved by orthodontic treatment. So it was also given by Moyers. Relapse is once the retention process is not carried out properly with the help of retainers, or the patient is not wearing the retainers properly, then the teeth is moved back to the original position before it was in the before orthodontic treatment. So there is a loss of correction. So the corrected teeth will move to their original position and there will be loss of orthodontic treatment. So that is called as relapse. Then stability. Stability can be achieved only by maintenance of the factors influencing relapse. That is, we should be maintaining or eradicating the factors which influences the relapse. There are various factors for relapse. So we are going to study that causes of relapse in detail in some other video. So that causes of the relapse should be eliminated in order to achieve the stability of orthodontic treatment. And this stability should also be carried out right from the step of diagnosis, and it should be continued throughout the treatment. So these are the three terms which we should be very clear about. So now, what is the purpose of retention? Why the retention process is so necessary after orthodontic treatment? The first thing is there are three main important reasons. This was given by Profit, an author called as Profit. So the main reason is that the gingival and periodontal tissues, actually they need, this was Profit. So the gingival and periodontal tissues, they require more time for the reorganization into a new position. So whenever the appliance is removed, they'll recoil back to their original position, so there will be loss of retention. So it should be given proper time for the gingival and periodontal tissues to reorganize to their original new position after orthodontic treatment. So that for that process a retention is necessary. Then the next one is the teeth was inherently unstable position. It is present in an unstable position once the orthodontic treatment is over. So there will be soft tissue pressures outside the teeth and inside the teeth by the tongue musculature also. So they will be constantly producing some forces, right? So that forces should be eradicated. So that forces will not be eradicated completely, but once orthodontic treatment is over, proper retention process is necessary in order to give a time for the soft tissue pressures. Then the next one is there will be more growth, because orthodontic treatment is carried out mostly in the teenagers or in less for the adults, right? So there will be growth remaining for the persons. So the changes produced by growth, it may alter the orthodontic treatment. So for that growth to be completed, we have to maintain the retention process. Once the growth is completed, then we can move on. So especially this is important in class 3 cases. because in class 3 tendencies, it is mainly the treatment will be modality will be based on the growth process. So now coming to the main topic, schools of retention. There are four pillars of the retention process. We'll see one by one. The first school of retention is occlusal thought, that was given by Kingsley in 1880, then Apical Base School by Axel Lundstrom in 1920, and it also given by two other authors, that is Macaulay and Nance. And the third one is Mandibular Incisal School, which was given by George Greaves and Tweed in 1944. And the last one is Muscular School, which was given by Alfred Rogers in 1922. We'll see one by one. The first is Occlusion School. As I said earlier, it was given by Kingsley. It is nothing but occlusion. The teeth is moved to a new position. So the stability of that teeth should be mainly depend on the occlusion factor. If there is proper occlusion, then there will be stability will be more, because the cusps of the teeth will hold the teeth in a new position properly, and there will be relapse will be less. Then the next school is apical base school. Apical base is nothing but it is a junction between the alveolar bone and the basal bone. So that is called as apical base. So according to Alex Lundstrom, the apical base is important factor. So what is that when the apical base is in a corrected position, then there will be maintenance and stability of the treated cases. So, and then Macaulay in 1944, he decided that the apical base should be strongly determined, and the intercanine width and the intermolar width should not be altered. If there is alteration of this both intercanine and intermolar width, then there will be relapse of the condition, because that decides the stability of the orthodontic treatment. Then, according to Nance in 1947, arch length may be permanently increased only to a limited extent and not to a extreme level. Then the third school of thought is mandibular incisor school, which was given by Greaves and Tweed. So the angulation of the mandibular incisor should be an important factor, because whenever the angulation of the mandibular incisor is correct, then there will be stability of orthodontic treatment. So the post treatment stability is increased when the mandibular incisors will be placed in a slightly retroclined position, or it should be placed in an upright position, and there will be proper retention is followed. So it should be slightly retroclined, or it should be upright over the basal bone, then there will be proper retention. Then the last school of thought is musculature school, which was given by Rogers. It is nothing but there should be a functional muscle balance once the treatment is over, in order to maintain the dentition in a stable position. So if there is a proper muscular balance between the outer cheek and inner tongue, so that causes stability of the orthodontic treatment. So there should be a balance between the outer buccal envelope and the here the cheek area, right, this area. So the outer musculature by the cheek and the inner musculature by the tongue should be in a equal position, or it should be in a neutral position. So if there is a more of cheek pressure, then there will be less tongue pressure, then it will be leading to a malocclusion. If the tongue pressure is more than the cheek pressure now, then it will be in a goes to a malocclusion, and there will be no retention process once the treatment is over. So the teeth should be placed in a proper neutral zone. A proper occlusion should be established within this bounds of the normal muscular balance, so that the retention can be carried out and relapse can be prevented. So these are the four schools of thought, friends, and we'll see in a next video. Thank you.